CultureVision is a web-based encyclopedia that's designed to help practitioners treat patients better. It's a tool that's based on years of research in understanding how people from different cultures have different needs in a medical environment. And right now, the tool applies to over 40 different cultural groups, 12 different religious groups, also several other groups, for example, people with disabilities, people from the lesbian, gay, bisexual, transgender community. And it's designed to help doctors, nurses, and other practitioners get the information they need at the bedside to be able to provide culturally competent care. What we're really trying to do is to give practitioners a way to help heal people better. I wish I could say that CultureVision was this great brainstorm or some vision I had, but the reality was it developed quite organically. A number of years ago, we were working with a hospital in Flint, Michigan, and doing a large diversity organizational change project. And among the things that we did as part of the effort was develop a training program and train a lot of people in the organization to deliver that training to their fellow workers. And we trained over 40 people. And one of them was a woman named Bonnie Jacobs, who worked in the IT department of the hospital. And Bonnie called me one day and said that just out of curiosity, she had run some numbers on patient outcomes based on ethnicity to see if there were any patterns of patients' health based on their culture. And it found that Vietnamese women in the hospital, when they delivered babies, were getting dehydrated more than other groups. And there was no explanation that anybody in the OBGYN department could give her. So we began to do some research and found that, in fact, the reason was cultural, that Vietnamese culture is traditionally based on hot and cold theory, and women who deliver babies are told that that's a cold time, and during cold times you don't drink cold liquids. But of course, nurses bring women in labor ice chips and ice water to drink, so it said they just didn't drink. It resulted in them getting dehydrated, which extended their hospital stay, which was a cost factor. It affected the mother's health, obviously, and it also impacted lactation, so it affected the relationship between the mother and the baby. And all of it could be simply resolved by a nurse knowing to say, what temperature water would you like? But of course, the nurses didn't know that and didn't know that they didn't know that. So once we got a sense of that, we started to look into it, and it was like picking up a rock and finding a whole world underneath it. We just found dozens and dozens of little tidbits of information like that, which in the early days we just began including in our training programs. And then ultimately we found out that there was so much, and it was so evolving, that we had to find a better way to deliver it to people. And that's where the notion of creating a web-based tool came from. And so now we continue to evolve it. We bring in research. We have a medical researcher who works with us. And we've expanded out to the point where we have over 150 hospitals around the country using it. What is culturally competent healthcare? Well, think of it this way. We've got more people living in the United States today who are born outside of this country than any time since the 19th century, almost 12% of our residential population. People coming from all over the world with different cultures, different ways of doing things. And that doesn't even include people who are born in this country but whose parents came from other cultures, or people who live in communities, intact communities, that infuse that culture into them even when they're born in this country. And they're coming into hospitals, into healthcare facilities in numbers far more than we've ever seen before. The average hospital in the United States today has people come in every year from more than 50 countries, some even more than that. I recently talked to one hospital administrator who said that they had people from 117 countries in their hospital this year. So culturally competent care is really understanding how that difference in culture impacts the patient-practitioner relationship. For example, people come in having different family patterns, different foods that they eat, different traditional medical practices that they use. They have a different sense of what medicine is or the relationship with healthcare. There are drugs that impact people differently, or some diseases that are prevalent in different groups more than others. And so culturally competent care is really understanding ways to develop services, practices, and a way of communicating that allows people from all different cultures to be treated effectively so that the medical interaction can happen in the way it's supposed to happen. What's the challenge now with all of these different cultural groups coming in? Well, if you think about it, we get into a healthcare environment, people at their most traumatized, they're at their most frightened, family members are concerned. A lot of people are scared even walking into a hospital. We've got so much history with healthcare. And yet we come in from all of these different cultural groups. Even if a practitioner really believes in being fair, treating people equally, and our experience has been that most do, that we don't believe that most people in healthcare environments don't want to do a good job. In fact, the opposite is true. People in healthcare are committed to doing an incredible job of taking care of people. But even with the best of intentions, when you have people coming into your healthcare facility from dozens of different countries, dozens of different cultures, there's no way you can remember all the information that you need. And that information shows up in lots of different ways. It shows up in how we communicate with the patient. It shows up with understanding what their practices are. When we offer treatment modalities to them, how do they react to those treatment modalities? How do they feel comfortable with them? What does immediate family mean in their culture? And what does body language mean? For example, when they don't make eye contact with us as a patient, what does that mean? All of these various different things. And so the real challenge is how can we get that information to the practitioner so that it can help the practitioner do a better job of serving the patient, serving the family, and taking care of the medical situation that's at play. It's not really something that we think people don't want to do. What we're trying to do is provide the kind of support tools to help them do what they want to do. Is there resistance? Of course, we encounter resistance sometimes. I think any new idea encounters resistance. And there are a couple of legitimate reasons why people sometimes resist the notion of culture vision at first. I think first of all, medical practitioners are really challenged right now. They're doing more with less than ever before. They're asked to take on more patients, to move faster. And for a lot of them, I think it occurs as first one more thing to look at or one more thing to worry about. And so the challenge is, how do I find the time for it? Now, one of the things we're finding for most of our folks is that when they really understand what culture vision is about and they begin to use it, that it actually makes their job easier, that it gives them information that allows them to get to the heart of things with patients quicker, to help family members more easily. They have less drama in dealing with patients and family members, and they can actually contribute to people more easily and more quickly. The second resistance often comes from people who say, well, aren't you stereotyping people? Aren't you treating me like a culture instead of an individual? And again, I completely understand that because our history is that when we identify people by their culture or by their ethnicity, it usually is for reasons of diminishing them. In actuality, of course, we can provide better care if we understand these reasons, but at first, people sometimes have that reaction. And what we found is overwhelmingly, once people understand what the tool is and what it's doing and how it helps people, that resistance also usually goes to the wayside, and we find that people are thrilled that their particular needs are met. The most important thing is we're not trying to say that culture vision is the answer. In fact, culture vision is one tool in a whole suite of tools that we provide and lots of other people provide to establish cultural competency. It's simply one resource that can help people produce the result that they're looking for.